So, also known as bromidrosis, or crocea, and very difficult to pronounce it, the tragomachalia, but I think it's not so often used. And there are two kinds of bromhidrosis. That is the apocrine bromhidrosis that occur after puberty, and the ecrine bromhidrosis that occur any age, including childhood. So from now on, I will use the osmidrosis, means bromhidrosis, since the bromhidrosis is a little bit difficult to pronounce it. The location of apocrine glands is in the axillary, the perineum, areola, and in the ears and the eyelids. And it located in the reticular dermis and the superficial fat layer. And below the skin surface, around 1.7 to 3.7 millimeters in axillary region. So when we will just undermine the area, we have to dip at least under the 3.7 millimeters. The distribution is extended from 0.5 to 1 centimeters. In some large area, even 2 to 3 centimeters away from each of the axillary hairs. But sometimes when we perform for those young ladies, most of them may have been treated by hair removal laser before the surgery. So in this,
I also asked the scan question to ChatGPT. It gave us a very good and comprehensive answer about the treatment modalities for axillary hyperhidrosis and osmidrosis. I also asked it, if we want to achieve safe, no scar, quick recovery, and short downtime, he gave me the answer, Botox injection. As you know, it's temporary treatment, only lasts for 4 to 6 months. It's not permanent. He gave me another answer. You want a permanent treatment, you can choose the microwave-based devices treatment. As we know, there are many treatment modalities for AO and AH, such as cleanser, perfume, deodorant, such as some antimicrobial agents for mild odor-forming bacteria, and topical antiperspirant, oral antiperspirant, such as anticholinergic medication, iontophoresis, neurotoxin, and the percutaneous internal injection, and the electrocautery, microneedle radio frequency, and so on. As you can see in red, they are surgical procedures. They are targeted at the interface between dermis and subdermis.
We watch the endpoint, but usually the blind technique, they don't know the exact complete removal or not. So the surgical technique has a long learning curve. Actually, I start with the Inarba technique, and then now I use the 1444 nanometer Nd:YAG laser because it has a little downtime, less scars, and then very convenient, and then the less recurrence rate. So learning curve, I mean, we have several options, several devices, but patient wants the different kind of desire. So I usually adapt to the patient's desire. So no device can cure this kind of symptoms or odors, I think. So the Miradry, the Professor Henry, I have a question about your presentation. So do you think it has enough data for the longer follow-up?
I worry about the thin case. The TAIWAN case, they are thin and exerciser. They have a low BMI, so they got thin skin. So this kind of patient, I will deliver more tumescent fluid for them. And repeat check the hand movement because the plexus injury is quite devastating complication for them. So I always worry about the complications. So the instance rate of branchial plexus injury is very low. I think maybe 10,000 to 1. But I think a stitch in time save is 9. So we don't want to make mistakes. So I sometimes I perform the ultrasound to check the depth of their danger zone. The danger zone, I think, is quite important for us because the thin area over there, it's quite provides a lot of benefit for surgical or non-surgical procedure. I think is quite good for us. And another my interesting is when I prepare for this article for this talk, I check the alcohol injection. I think it's quite cheap in therapeutic way. Yes, very cheap. Maybe the machine factory will kill us. Now the alcohol injection is very cheap. But I think in the Indian article, it's a good result. It reached to the 92%. I think that's maybe it can perform as a supplementary treatment for the recurrent cases. We can use it to deal with the local recurrence. We can perform the starch iodine test to define where as the recurrence area. We can retreat with the alcohol injection, I think.